Hi there. I know why you're here. You're probably fed up with your neck pain, your back pain, headaches, migraines, shoulder, knees, and toes pain. Any pain that you're currently experiencing right now, you don't want it anymore. And you're here because you were researching of things to do to say goodbye to these pains. Right? Am I right? Because I believe I'm 100% correct. And you are in luck today because the first episode of Thrive RMT podcast, we are going to be talking about the benefits of massage therapy. And of course, the importance of self-care and exploring various holistic approaches to your health and wellness. So if you are ready, let's get started. Hi there, Thrive Mates. My name is Stephanie May Palisok, and I'm a registered massage therapist here in Toronto, Ontario. And I'm also a massage therapy instructor in a private college here in Brampton, Ontario. And the main purpose of this podcast is to share awareness about massage therapy. So next time you would know what massages to get, not only for your relaxation massages, but also to remove and say goodbye to your aches and your pains. Are you excited? Because I am excited. Yeah, that's why I prepared a couple of things to talk about massage therapy. And I know that there are already a lot of blogs, articles, researches, or other extra resources that you can find online about massage therapy. But this is based on what I have seen so far in my own practice as massage therapist. And maybe you can relate to these things as well. So let's get started. Let's talk about the basic thing, which is the benefits of massage therapy. What are the main benefits of receiving regular massage therapy first? Because in my experience, most of the people that I see for the first time, the reason they say is because they're gonna be like, "Oh, I have a lot of tension. I just want a relaxation massage, blah, blah, blah." Those kinds of reasons, right? It's not a bad reason. It's a good reason. Actually, that's one of the benefits of getting massage therapy, right? To release the general tension in the body, increase relaxation. But let me tell you right now, okay? Let me tell you straight up. Relaxation massages are not the only advantages of getting regular massages. It's also like maintenance, right? Like let's say in your car, when you have a car, you can't just keep using it and not taking it to the mechanic or checking its oils, putting gas into it. You need to maintain it, correct? It's the same thing when you go for regular massages, maybe once a month, right? Just to get a general treatment to release tension in the most used muscles in your body. So maybe, let's say you're a factory worker, so you keep doing this motion, maybe left and right motion. If you keep doing that, there's a tendency that you're overusing a lot of your neck, shoulder muscles, and it might cause pain and tension around these muscles. And we don't want that. We want to be healthy. We want to be pain-free. Because how can we work and earn money or support our living if we are in pain? You're not going to be motivated to work. You're going to feel lazy. You're going to feel not really depressed, but some patients that I had, they even cry. Some of them, they cry in front of me. This is very rare. You might not even heard about this, but I did have some patients that would cry. They would cry because they cannot tolerate the pain anymore. They just want to get rid of it, right? So that's one main benefit of receiving regular massage therapy. It's to maintain, release general tension so that you can be prepared when you work, right? You're not overworking yourself. You're reducing the load of your muscle and joints to be more stronger. And for the weak muscles, you can strengthen them. So it's like maintenance, right? And one thing that I have noticed as well, especially if you're already doing your maintenance massage, maybe let's say a once a month massage, is that once your massage therapist was able to get rid of these knots or trigger points or the painful spots in your body, you're gonna be able to adapt to it. Like your body's gonna start adapting to it, and then the other body parts that are affected would start loosening up, and you're gonna start to feel relief. And now when you are continuously on doing this, you are going to feel pain-free. So, meaning to say, the next massages you're gonna get would be more of a relaxation massage. It's not gonna be focused on pain anymore. It's gonna focus on relaxation massages now, right? Because you're relaxed. It's not just this. It's not just your mind being relaxed. It's also your whole entire body. Mentally, physically, emotionally, you are relaxed because you're no longer thinking about the pain. You're not focused about your overused shoulder pain. You're just focused on your full body relaxation massage and removing this general tension, general stress, because no more pain. Bye-bye, right? That's one advantage. So it's something that you can think about, right? Another question that I usually get as well is that, can massage therapy help with pain management and muscle tension? Like what I've said, yes, right? That's the actual point of massage therapy. So besides increasing the blood circulation and the other fluids that are also circulating around our body, besides improving on that aspect, we're also releasing the tension on the muscles. So by, basically, we're also removing the tension in the muscle and releasing pain by increasing blood circulation. Because if you don't know, the blood is actually a transportation agent in our body to spread nutrients and to get rid of the wastes that the body doesn't need. So that's why during the healing process, it is important that there is blood circulation in the damaged area or wherever the injury is, because you want to promote circulation there to fix the problem, to get rid of the things that are not supposed to be there, to help in the healing process. That's why blood circulation is nice. So, yeah. And again, in general, there are a lot of reasons of why you might just go for a massage, but please bear in mind that it's not only for your relaxation. It's an all-over cycle. So I always explain it to my patients this way. Number one, if we get rid of your pain and general muscle tension, your posture is going to be better, the weak muscles are going to be strong, the tight muscles are going to stretch, it's going to promote circulation, and the pain would be decreased. Then you can enjoy the massage itself as a relaxation massage. Do you get what I mean? Long story short, we should get rid of the pain first and general tension, and relaxation is going to come after that. It's because your body, your nervous system is now calm. You're not thinking about anything that causes you to have anxiety, right? You're just here to get a full body relaxation massage because there's no more pain. That's why it doesn't mean that there's no more pain, you don't go to massage. You need to maintain. So those are the benefits of massage therapy. And those are also one of the things that I have noticed when I'm treating some patients, especially for those patients that they kind of don't believe that massage therapy would help with their pain. I always tell them, your joint will not move if your muscles are not moving correctly. Without the muscles, your bones are just joints and bones. That's it. Without the muscle, there is no movement. So we need to make sure that everything is open up, everything is clear, so that you can enjoy your relaxation massage. And you can do both, right? By actually maintaining your massage therapy sessions. Is that amazing? People tend to think like a one-time massage can help everything. Let me tell you right now, most of the RMTs or massage therapists that I worked with before, they would say that, oh, these patients, not the educated patients, like they don't really know about massage therapy a lot. They just come for a regular massage thinking that that's it. And then they're going to tell their RMTs or massage therapists that, oh, just get rid of this pain and here, blah, 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 blah. Let me tell you right now, it's not enough. Sometimes 1 hour is not enough to get rid of everything. It needs series of treatments. And based on my practice, I have seen a lot of returning patients because I'm able to make a treatment plan that works for me and works for them. And of course, it needs to be client-centered. I'm not the one who owns, I'm not the one who owns the patient's body. It's the patient who owns their body. So it needs to be win-win. It needs to be a meet halfway situation. And sometimes, please don't expect us to treat you in one shot. It's hard. It's impossible. And this goes to my next topic. Types of massages, right? So here in Thrive RMT at least, or in my own practice, I commonly use techniques like trigger point techniques to remove some knots that can cause pain. So if you don't know what trigger points are or knots, it's a hyper-irritable spot in the taut band muscles, taut band part of the muscle, meaning it can cause pain locally that can be referred either going up your head, down your neck, or anywhere in your body. So for example, you have a pain on your upper shoulder. If a trigger point is active, it can cause referral pain that can mimic headaches. So some people, they would be like, oh, I have headaches a lot, but sometimes it's just probably because of the knots, right? And of course, to get rid of that, we need to include and increase circulation in the area, the same way I have mentioned with the benefits of massage earlier. So some techniques would be a fascial technique to release the fascial restrictions in the body. So if you're not familiar with fascial, the fascia itself, I would say that the fascia is a connective tissue that connects the skin and the muscles and one organ to another organ. It's like tape that connects two organs together, skin and muscle, another organ to another organ. It can be superficial, meaning a little bit closer towards the skin, or maybe it can be a little bit deeper. Now, the problem is if the muscles are too tight or too weak, the fascia around it can also be affected because it's too tight or it's too weak. So basically, it's not in its normal position and it can't just separate like, oh, it's a muscle problem. I should not get involved in that. No, because they're very attached with each other. They're very close. They actually are sticking to one another. You can't just separate them because you want to separate them. So that's another technique that can be done to reduce some tension in your neck pain or any pain that you're experiencing, is to remove fascial restriction. If you reduce the fascial restriction, then your muscles can move a little bit more. And if the muscles can move a little bit more, then there would be less pain. And of course, once all the pain are gone because of the fascial restriction, fascial technique and the trigger point technique, you're going to slowly enter a phase of relaxation. Because now blood circulation is working in the problem area, and you're probably, not feeling as much pain anymore. Long story short, doesn't matter what type of massage technique or what type of massage you're gonna get, as long as the main goal is increasing range of motion, increasing blood circulation, right, is the number one or the main priority for the treatment. It can definitely help you a lot already. And it's because with no movement, you're not gonna encourage circulation at all. And that's the problem, right? I don't know if you can relate to this. Hear me out. Let's say you were running, you were jogging, I don't know, you were doing something and then you tripped, or slip and fall, let's say. And then you suddenly felt pain on, let's say, the left shoulder. Right? And because it's painful, the first course of action you're gonna do is you're gonna avoid to move it. And that's where the problem is. If you refuse to move the left shoulder because it's in pain, you're not really increasing fluid or circulation on the left shoulder. So what's going to end up is you're going to be immobile. And when an area is not moving or it's immobile, it can also affect the muscles around it. Your muscles are either gonna stiffen or they're gonna be tight or weak, and it can cause more issues in your posture, and in the long run it may cause re-injury, or worse is, it's not gonna heal properly. So you're still stuck with the pain. That's why I heard it from a student that I have. He works as a personal trainer, that the best way to remove the soreness after a heavy workout is to move. Okay, let me go back a little bit. If you don't know the thing called delayed onset muscle soreness, that's it. When you work out too much and then the next day you feel so sore? That's it. That's DOMS. That's delayed onset muscle soreness. So basically, according to my student who is a personal trainer, he said that the best way to get rid of this soreness is to move around to remove the lactic acid that causes the soreness. And it's the same concept of what I'm talking about, increasing mobility. Right? You need to increase movement on the problem area so that you can increase circulation and promote healing. Okay? But don't move it too much. Right? Like, don't be like, oh, Steph said you have to move it too much, so you're gonna just move. No. We're not overdoing it. Just a little bit of movement after the healing process or the initial healing process will help in completely removing the pain, so that as the time goes by, you're not stuck with it. If it's after 2 weeks or a month and the pain is still there, it's probably because the joint is immobile. So you need to open everything up, right? You need to open everything up to make sure that blood circulation comes in to help you with your pain and dysfunction. If you don't know, massage therapists are trained to do assessments to ensure that we are giving you a safe and effective treatment. What do I mean by this? What do I mean? Hear me out. We are trained to learn special orthopedic tests to figure out very specific orthopedic conditions that may cause the issue that you're experiencing. So we need to thoroughly assess which condition it is, like checking your range of motion, testing the muscle, making sure that no nerves are affected during this time. Once we know the timeline of your conditions, based on how far along are you on the timeline of the injury and based on our assessment, then we would say what kind of movement or what kind of exercises can you do to not aggravate the pain but at the same time relieve your pain. So it is also important to know the risk and precautions of your massage treatment. So besides of knowing the proper timeline to use specific techniques, it's also important to check systematically. One thing that we ask every first patient that we would have is to fill out a health history form. This health history form would help us determine where we would treat an area or where we would assess prior to the treatment. And besides that, we would also know the contraindications of the treatment we're gonna give to you. So I'm gonna give an example. Let's say a patient is experiencing high blood pressure, or they have a history of high blood pressure. And then the patient came in for a massage, let's say, and their blood pressure is not really on the normal side. It's abnormal. So it's an indication that massage might not be the best option for the patient because it might cause complications, right? Another example, what if your patient has a very severe or big wound, either maybe on the hand or anywhere in the body? That's a common sign of contraindication, right? We cannot just wear gloves and massage the wounded area. We need to wait until it's fully healed. Or else we might cause infections. Maybe the oil we're using can cause infection to the wound and such. Another thing is maybe you have a contagious disease. Maybe you have flu at the moment. Or maybe your therapist has a flu at the moment or COVID. Those types of things are something to be precautious about because it's not because you're going to be not having the best treatment ever, but it's, again, it's a contagious disease. You need to rest for that. Meaning to say, you need to wait a little bit, make sure you're properly healed up, and then get your massages. That's what it is, right? So how would we know this? Again, like what I said earlier, we are going to know this through the assessment that we are going to perform prior to your massage treatment. And Steph, some massage therapists, they don't assess. They just tell you that go under the sheet and stuff like that. They have their reasons. Okay, I don't know what reasons they are, but in my practice, I usually make sure that I do assess as much as I can. Here's the thing. I don't want to go and do your massage without knowing what the problem is. Yeah, I can just do a regular full body massage for you. Not a problem. But what if I actually assessed you and figured out issues that are causing real or deeper problems than we expect, and this one can give you long-term results than short-term? It's because we know already, right? This is because we know what the problem is and we're here to fix it. And that's my number one motto as a massage therapist. Mind you, I always tell my patients that I'm still gonna go, meet you halfway, do a full body massage if you want. But if I see something painful like fascial restrictions, trigger points, I'm gonna treat them along the way. And for me to know that, I need to assess you. I need to see what your range of motion is. I need to see how your posture works, right? How do you walk? Or if it's relevant, or if there is numbness and tingling, where is it? Is it towards the front part of your hand, towards your wrist, your fingers? I need to know. Basically, doing assessment is another way of figuring out what the problem is and solving it. Because if we don't assess, if we don't figure out what the problem is, I won't know where to treat you. Yeah, I can just do a full body, not a problem. But again, which is more beneficial? Finding the problem and solving it, or acknowledging that there's a problem but not really doing anything about it? So which one is which? Do you want to get rid of the pain long term, or you want to get rid of the pain short term? So those are two things that you need to think about, right? So besides the precaution, that's the major gist of it. To summarize today's episode, what I want to say is that massage therapy is beyond relaxation massages. As a massage therapist, it is our duty to actually look for a problem and solve them for you. And for me, it does make sense to do it that way, so I'm not wasting your time, not wasting my time, and you get the optimal results that you want, right? Because again, who wants to live in pain? Because me, I can't. I can't live in a painful situation. I want to get rid of it. So that's something to think about. The point is, yes, massage therapy is to help generally relax your mind. Yes, I do agree with that. But again, massage therapy is beyond. It's beyond that. It's about treating everything as one whole. If you want to be relaxed mentally and emotionally, then you need to get rid of the problems that you currently have, right? And I mean, speaking of massage, at least massage therapy can focus on your aches and pains so that eventually you can just be on full relaxation mode. Right? Because I always love that solution. Always go for the long term. And again, there's nothing wrong with relaxation massages, right? Relaxation massages are nice. It's just that for me, my opinion is relaxation massages are sometimes short term. If we target a problem area for their massage, their follow-up visits would be a little bit better compared to the previous one they did. So eventually, they're gonna start a painful massage until all the painful parts are eradicated or flat out already. They're clean, they're fixed. And then from there, they end up enjoying their massages. And how can I prove that massage therapy is not just for relaxation massages? It is because we also provide some self-care exercises that patients can do. So after the massage, we might give you some stretches to do for your neck, for your shoulder, knees and toes. But yeah, like for example, in my own practice in Thrive RMT, we actually provide a self-care plan after your first visit. And this is based on the assessment that was conducted prior to your massage. And it is isolated or made based on the results. So if you are an office worker who's always slouching like this, then the self-care plan that we would give you are stretches and strengthening exercises to open up your chest area, right? and actually help you with your posture so you're not slouching too much already. You're going to be, it's going to be a little bit open, right? And again, by doing these self-care exercises, it can actually give you a long-term result because you're not going to have massage every day, right? So while waiting for your next massage, by doing this self-care exercises, then you're going to be able to, again, extend the quality of care that you're getting from one initial massage. Isn't that nice? I love sharing that to people, that massage therapy is not just a quick, relaxing thing. It's beyond that. That's the quote for today. Massage therapy is beyond relaxation massage. Perfect. Right? I love that. There are a lot of ways to actually incorporate massage therapy in your holistic wellness routine. It doesn't need to be massage therapy focused. You can go for a chiropractor, you can go for a physiotherapy, you can go to other alternative healthcare professional. But what I'm saying is massage therapy is also focusing on the muscle itself to help open up the muscle if it's too tight and strengthen the muscle if it's too weak, to help with general movement in using various and very specific massage therapy techniques. So going back to what I said earlier, if you are fed up with these aches, pains, headaches, everything, you might consider doing massage therapy to see if the muscles are the actual issues of your problems, right? And again, there is always an assessment. There should be an assessment prior to your massage, and at least you would have a clear idea of what is wrong. And adding some heat packs, self-care exercises while waiting for your next massage can help you reduce the pain. And again, this is a long haul, Thrive Mates. This is a very long thing. Don't expect it to happen one shot because it's not going to be like that. It's a slow burn type of treatment, but when the end comes near, it's the sweetest spot. It's the sweetest end that you're gonna experience. It's because no more pain. You're fully relaxed. That's it. And I hope you learned something for that first episode. I think it's too much. I think I talked too much. So thank you so much, Thrive Mates, for listening and tuning in the first episode of the Thrive RMT podcast. And please do not forget to leave a like, subscribe, and comment. And of course, share this podcast to your family or friends that are in need to say goodbye to their aches and pains away. If you want additional information or you want to correct something out of what I've said today, feel free to check the email below, and I'm happy to answer further questions or accept new topic suggestions. So again, until next time, my Thrive Mates, goodbye!